Welcome to a Treatment Studio tutorial on tracing the inferior alveolar nerve. When a case loads in Treatment Studio, you will be viewing the Art Section tab. In the View Control window, select Change Layout and select the top left radio button labeled Axial Panel 3 Cross Sections. If the mandible is not fully viewable in the Panoramic View window, select Adjust Range and Orientation in the View Control window. Next, left mouse click on a green horizontal line in the panoramic view, and while keeping it depressed, move the mouse to include the desired anatomy. It may be necessary to move both lines. To complete, deselect Adjust Range and Orientation. Select Slice just below the panoramic image in the View Control window. Next, adjust the views for better visualization of the canal. In the View Control window, adjust the brightness, contrast, and image sharpening as necessary. If the full length of the nerve canal is not seen in the panoramic view, begin by moving the horizontal orange line on the panoramic to just below the CEJ of the lower central incisors. Next, create Art Spline by left mouse clicking on the icon twice. You will be asked, do you want to create a new spline for focal trough? Click New. Place points in the arch by left mouse clicking every ½ inch or so. Begin just posterior of the mandible on either side and continuing through the middle of the arch until you go past posterior on the opposite side of where you started. Left mouse click to set the final point, then right mouse click to create the new spline. You may do only one side of the arch if desired. To adjust the canal visibility, place the mouse pointer on top of a red outlined yellow dot which resides in the general area where the nerve canal is not clearly seen. While holding down the left mouse button, move the dot either buccally or lingually until you see the section of the canal clearly in the panoramic view. Repeat as necessary until you see the full length of the canal in the panoramic view. Next, place the mouse pointer on the vertical green line in the panoramic view, and while holding down the left mouse button, drag the line until you see the inferior nerve exit at the mental foramen in a cross section. You are now ready to create a nerve pathway. A pathway can be created manually or by using the automatic nerve feature to find the less dense canal. In the View Control window, accept the default diameter in the manual nerve pathway setting or adjust it for your preference. Click New Nerve. Left-click the mouse where you want the nerve to start. Move the mouse to the next point along the path and left-click again. Position the point so that the pathway indicator rests along the superior border of the canal. If you make a placement error, you can delete the last node by pressing Delete in the View Control window. Repeat this procedure until you reach the green vertical line that was set earlier. Left-click on the most lingual aspect of the nerve in a cross-section and another at the exit point. Press Done to finish. The inferior alveolar nerve may extend beyond the mental foramen as an intraosseous anterior loop. To mark this extension, click New Nerve, left mouse click in the canal on the green vertical line, left mouse click at the end of the anterior loop, and press Done to finish. To check your work, select either the Volume Renderer or the Implant tabs. To delete a nerve, left mouse click on the segment, and when it changes to a brighter shade of red, select Delete on the keyboard. To create a pathway using the automatic nerve feature, first select Pick Seed Points, then place at least 2 points within the canal in the panoramic view, one at the most posterior aspect of the canal, and another where the nerve canal exits at the mental foramen in one of the cross sections. For some cases, 3 or 4 points may provide a more reliable detection. Press Finish to end. The canal is marked following the less dense pathway. To mark the interior loop, select Pick Seed Points again and place a point at the green vertical line and another at the end of the canal. Press Finish. Now let's check our work in the Implant tab. If an implant is placed within a preset distance between the alveolar canal and an implant, a warning will appear. The automatic nerve feature will not be available if the volume has been reoriented. To reset the volume orientation, select the Volume Renderer tab. Next, select Patient Orientation on the toolbar, then select Reset to Image Coordinate System. The automatic nerve feature will now be available for use. Any nerve that is traced in a way that does not conform to the actual pathway of the nerve can lead to surgical complications. If diagnosis, treatment plans, and/or actual treatment is based off of an incorrect tracing, it is critical for the end user to learn how to properly perform nerve tracings correctly. If you notice any inconsistencies or software problem with nerve tracing, or have further questions or concern about nerve tracing, please contact Imaging Sciences Technical Support at 1-800-205-3570 or email us. This concludes Imaging Sciences Treatment Studio tutorial on tracing the inferior alveolar nerve. Thank you for watching.